the African and Asian American communities by bringing information about the Affordable Care Act and Medicare to our communities. She presented at the Seattle Digital Conference, or Summit, to raise awareness on the growing digital divide. She serves on the Seattle-King County Aging and Disability Advisory Council, Washington State Health Benefit Exchange Outreach Advisory Committee, Valley City Board of Directors, and the Puget Sound MIT Alumni Association Board. Suzanne has managed global teams at Microsoft and JP Morgan Chase to make customer-centered marketing and service strategy a reality. Her expertise in market research, data analysts, and online communication technology brings a refreshing perspective to the topic of cancer prevention and disparity. Let's welcome the leader for the Stomach Cancer Project.
I think this is a little better. Before I get started, I don't want to put Courtney on the spot, but I really wanted to acknowledge her presence. Courtney, Clea, do you want to stand up? She is actually from Picori itself, and she has flown all the way from Washington, D.C. to attend this conference. And she has told me that she is very passionate about stomach cancer as well, because that's one of the things that she studied. Was it in graduate school? Yeah, so I was so excited that Picori is here to participate in this summit. Thank you. So I have to say that when Linda showed you the timeline, it was a very tight timeline. We found out about the grant, and then we found out we got the grant in the space of less than 2 months. And when I first got it, it was jubilation. And then I was like, oh, well, I'm not an expert in stomach cancer. How am I going to do this? So I was freaking out a little bit. But what I realized is that in this case, it's actually probably a good thing that I'm not an expert in stomach cancer, because I get to ask a lot of dumb questions. And I get to kind of absorb all this information and try to demystify for everybody, because stomach cancer is a really complex topic, and I am still learning. So the first 3 questions, kind of like a journalist, that I started asking to the experts like Juha and Linda and everybody on our advisory council, Mo Kyung, Dr. Park, is what is stomach cancer? So Dr. Juha Wang has explained it from a medical perspective. And the second question is, who is at risk cancer? So this morning you had a chance to hear about the types of ethnic groups that are at risk as well. And then during our discussion topic, we actually had a chance to talk about what types of lifestyle factors put you at risk as well. But the third question, which I found to be the most intriguing in some ways, is why are they at greater risk in the United States? And it was intriguing for me because we tend to think about United States as being the country where you have lesser risk than other countries. And that's true in most cases. But I think stomach cancer is a glaring example of the fact that we actually are not the leader, but we could be the leader. There's nothing stopping us from either an innovation perspective or a policy perspective. It's just that we're not there yet. So I think this is a really great opportunity for us to think about how we can take a customized approach to cancer prevention. So we started talking about some of the factors, and so this is Dr. Cheng Byung-shin. He's the founder of Cornerstone Medical Services. And I put it into an easy graphic for me to be able to understand. So these are some of the healthy nutrition and lifestyle factors that put you at risk for stomach cancer. So, go ahead, can you keep it, actually, can you go back up? One more, yeah. So salted fish, smoked meat, pickled vegetables, and smoking. And when I saw that, I was like, yeah, you know, I can kind of understand why Koreans are in trouble, because this kind of makes up the diet for a lot of the Koreans I know, probably me at some point as well. So there is definitely things that we can do from a communication and education perspective to raise awareness. As Dr. Jua Wang said, it's all about moderation. There's other things that was also a surprise for me as well in terms of who is at risk. And these are the types of factors that really, as Dr. Wang said, should alert you to say, I should actually get tested. Now, we actually have a couple of health insurance companies here with us, United Healthcare and Molina Healthcare, and it was important for me to invite them because we knew that partnership with insurance companies is very important to the success of our project. I mean, it doesn't really do us a lot of good to do all of this awareness and then patients to go and get tested and find out that they are not covered by their insurance plan. Luckily, if you have the symptoms like chronic indigestion, stomach pain, acid reflux, or ulcer, you actually are covered because you are what you consider symptomatic. So if you have any of these types of stomach problems, you can easily get covered by health insurance. It's just that most people don't link these kinds of everyday problems to stomach cancer, which seems really dire. And then there's also vitamin B deficiency, H. pylori infection, which we talked about. And what's really interesting for me is that H. pylori is kind of like hepatitis B, right? All of you guys are aware of hepatitis B and the linkage between hepatitis B and liver cancer. So it's similar type of a thing, although as Dr. Juha Wang said, just only focusing on H. pylori is not enough. But there is some kind of a relationship between H. pylori and stomach cancer. Prior stomach cancer surgery, when I first saw that, it didn't make sense to me, but hearing Dr. Wang speak about how surgery is done in the United States, that actually does make sense, because if the surgery is incredibly invasive or if it's not done properly, it actually can cause more problems down the road. And CDH1 gene mutation, which is a rare form, and this is a gene mutation that actually makes you more susceptible to gastric problems. So we've covered who is at risk. Why are they at greater risk? We don't actually definitively know, but we have some hypotheses that we talked about in our advisory council meetings. One is that it's not just true for the United States, it's true for any country. You tend to hear about cancers that affect the majority of the population. So for United States, breast cancer incidence, you see the North American map being all red, and prostate cancer, that's also red for United States. You hear a lot about that because that really does in fact affect large numbers of Americans. But immigrants' cancer risk profiles often resemble that of their native country, not the country that they're moving to, especially if they came in the last 10 years or so. So here we have stomach cancer and cervical cancer. Stomach cancer, as you see, is like completely red in Asia. And you also see South America being red and orangish. Cervical cancer is also a cancer with disparities. And that one tends to affect more of Southeast Asia, Africa, and Latin America. So when I started doing my investigation, I was curious to see what other states were doing to raise awareness on stomach cancer. And the simple answer is not much. There really is not any widespread program done in any state to systematically raise awareness on stomach cancer to the extent that we have in Washington State, for example, with breast cancer or cervical cancer or lung cancer. But when I looked at California, Texas, New York, and Washington, I found out that pretty much the three states are all ahead of Washington State in terms of providing the information through their cancer reports. So California and Texas both have cancer facts and figures reports, which is a wonderful resource, and that actually does raise awareness on cancer disparities and also provides very basic level of prevention guidelines. And New York State, I'll talk about a little bit later in terms of what they do. Now, what's really cool about California's cancer facts and figures is that it lists top 5 cancers for the Asian and Pacific Islander ethnicities, as well as race. So some of the groups that are listed are Korean, Hmong, Japanese, Vietnamese, and Laotian. And it turns out that for all of these groups, stomach cancer is actually in the top 5. They also list Chinese, Filipino, Hawaiian, and Campuchian, who don't have stomach cancer in the top 5. In addition, California is one of the few states that actually lists cancers that affect minorities disproportionately. And they provide basic prevention guidelines for stomach cancer as well as other cancers. So I'll read what California has said about it, and I'm sure Dr. Wang will say this is very, very basic, so we could do a lot more than this. But I was very pleased to see that they had done even this much. So what they basically say is, avoid foods high in nitrates, avoid use of tobacco products, eat diet high in fresh fruits and vegetables. So that kind of applies to a lot of different cancers, right? ED, that is early diagnosis. So health-related checkups may identify early signs and symptoms. Again, very basic level of information. WS's warning signs is indigestion. And for treatment guidelines, surgery plus chemotherapy, radiation therapy for later stages. So that's basically what California says. And our hope is that we can provide a much more robust guideline. Now, it's going to be hard for you to see this, so you don't have to try to read all the numbers, but I actually did a screenshot of California's cancer facts and figures. And what's really cool is, like, if you can see in the light green, these are all of the ones that actually identify stomach cancer. So you can actually see stomach cancer popping up in top 5 incidents for both males and females for several of the Asian American groups. And then I mentioned that California shows the list of cancers that affect minorities disproportionately. And what was really interesting, and I don't know if it was coincidence or if it's because stomach cancer really is the biggest disparity, but it actually shows up first. So stomach cancer is listed first for not just Asian Americans, but Hispanic and African Americans. So I found that to be quite intriguing, given the fact that there is so little awareness around stomach cancer. Now, shifting gears to Texas, by the way, I just want to know, how many of you guys have actually ever lived in Texas? Okay. I actually lived in Texas as well, and I grew up. And I know that we kind of, in Washington State, like to think of Texas as being backwards and, don't really care too much, I guess, about progressive causes. But in fact, Texas actually has a really great health system. And they have Anderson School of Medicine, which is one of the leading schools in the world for medicine. And they actually do a lot of work around awareness of cancers. So their Texas Cancer Facts and Figures, there are 4 things that I found to be really cool about them. The one is that they list top 10 leading cancers for the state. Now, a lot of state reports do this, but what was really interesting for the Texas one is that stomach cancer was the 10th highest one. So in Texas, it's actually higher than in some of the other states. They also list top 5 cancers by both race and actually not ethnicity. They do it just for race, but they do it for both incidence and mortality. So when we looked at California's cancer facts and figures, it was very detailed, but it was mostly about incidence, which basically means here are the new cases of stomach cancer for each of the groups. Now, why is mortality important? Because as Dr. Wang said, stomach cancer actually is one of the most lethal cancers. Breast cancer has far larger numbers than stomach cancer, but there's also higher prognosis in survival rate. So looking at mortality is a really good indicator for figuring out which of the cancers we need to address. And they include survival rate by stage of cancer, which we will show shortly. And so just to kind of give you guys a little bit of background, because I didn't know this myself. So stage of cancers, I think there's like 4 or 5 stages, right? So when Dr. Wang was talking about 25% mortality rate in the United States, that's average across all of the different stages. And then I think the earlier stage is localized, and then the middle stage is regionalized, and then the last stage is distant. So the fact that Texas Cancer Facts and Figures is listing this by stage is pretty profound, because we actually have a chance to compare how stomach cancer ranks by stage against all the other cancers. And the final one is that it's actually a great display of information. They do a great job with graphics. So this is the first chart. As you can see here, stomach cancer is in the top 10 of all of the cancers overall in Texas. So the first one is lung, followed by colon and rectal. I'm sorry. Okay. I think when I turn around, it gets worse. Okay, no, maybe I'll just keep it. I apologize for that. Okay. Okay, just leave it there. Don't touch it. Okay. Oh, okay, stand in front of it. Okay, stand in front of it. Okay, so I can't turn around then. Okay, basically, all right. So lung, followed by colon and rectum, followed by prostate, followed by pancreas, which is another cancer that Dr. Wong is working on, followed by liver, which we're going to hear shortly from Dr. Vicki Taylor, leukemia, non-Hodgkin's lymphoma, kidney, and esophagus. And then stomach cancer is the 10th most prevalent one. Now, I'm not going to read this chart because there's too much information, but this is the one where I was talking about showing the survival rate. So when we look at survival rate, it actually jumps up from 10 to 5. So among the cancers that are listed here, stomach cancer is the 5th most lethal cancer. So we're talking about pancreas having the worst survival rate at 5%, followed by liver cancer at 12%, and this is just for Texas. Lung cancer at 15%, esophagus at 16%, and stomach cancer at 25%. So it kind of gives you an indication of how severe this condition is. Now, this one, I actually did a snapshot of Hispanic and Asian Americans and looking at both incidence and mortality. So this is another way for us when we're looking at data and thinking about how to communicate this information. We see that from an incidence perspective, stomach cancer shows up for Asian Americans, but not for Hispanic Americans. When we look at mortality, stomach cancer shows up for both Hispanic Americans and Asian Americans at our higher ranking. Now, in doing my benchmarking for these 4 states, I found that California is the only state where the stomach cancer incidence for Asian Pacific Islanders is provided at a detailed level. And California is the only state that also officially produces guidelines for stomach cancer prevention. It's not to say that in the other states they're not doing research work at research universities and private institutions. There is work going on in all of these states. It's just that it hasn't percolated up to statewide public health guideline at this point. We found out about Texas and what they're doing. So even though Texas doesn't do it by ethnicity and they don't produce a stomach cancer prevention, they're doing a lot of really cool things. And New York, they don't know the risk factors. They don't know who is at risk for stomach cancer, so they don't ask for it. They don't inquire and they don't do their own research. And the second is that, and this is especially true of some of the recent immigrants, Asian Americans, whether you're talking about Vietnamese or Koreans or et cetera, they don't see doctors very often. And that's related to not having health insurance, which we're trying to fix by enrolling as many people as possible through the insurance. And even when they have insurance, they're new to it, so they don't actually understand what the benefits are and what's covered under preventative and not. And from a health professional perspective, the prevention guidelines are not available for stomach cancer. So we know about some of the bigger cancers and the fact that, for breast cancer, if you're over a certain age and if you're in this ethnic group or demographic group, you should just get tested no matter what, whether you have symptoms or not. That kind of guideline does not exist for stomach cancer. And there's also public emphasis on some of the more mainstream cancers, which makes it harder for other cancers, like whether you're talking about pancreas cancer or esophagus cancer, cervical cancer, et cetera, or stomach cancer, to get that attention for even the target populations that we're talking about. And finally, from a policy perspective, there is a myth of a model healthy Asian Americans. And there are several of the folks here, like Michael Eady, he's the executive director for the Washington State Commission on Asian Pacific American Affairs. And we're seeing this issue in many areas, whether we talk about health or education or et cetera. People simply think that Asians don't have problems and that we're okay and we don't need any assistance. And we know that that's not true, especially at the lower socioeconomic levels or those who don't have health insurance. So we are trying to combat that. And what makes it also tough in the specific case of stomach cancer is that because there isn't availability of disaggregated data by ethnicity, and because there's also underreporting of cancers by Asian Americans, this was actually something that Massachusetts and New York and California have raised awareness on. Those two things kind of conspire to continue to reinforce this myth. So at this point, we can think about where our project is headed and how our project can address some of these challenges. Now, one of the things that quickly became apparent to me is that our project can't do it all, right? For most of the other cancers, there are many parallel research projects going on at the same time. Some of them are clinical, some of them are medical, some of them are outreach and education oriented, some of them are healthy nutrition and lifestyle oriented, and they all work in tandem to reinforce each other and do work that helps get the message out. Because one project, our project, can't do it all, we're going to focus on education and outreach and hope that Dr. Huang and Dr. Linda Ko will be able to apply for separate grants to do a large-scale clinical trial related to stomach cancer guidelines and early detection. And we're going to also try to work on doing separate type of project that is more focused on true prevention, which is focusing on the lifestyle factors. And throughout this process, the questions that we're going to be asking are, what is the current state of stomach cancer prevention? So this is the very first year that we are doing this. As we continue to actually talk about stomach cancer, we're going to measure not only our own progress, but the progress that other states are doing and other organizations are doing. And the question that we will continue to ask our advisory council members, and hopefully you guys, if you come back next year, is where is the desired end state that we want to achieve? What are the end goals and metrics that we want to reach? And really, as I kind of take a step back and think about this project, there's two key takeaways that keep coming back to me. The first is that we really don't know why early detection is so low for stomach cancer. We have ideas and we have guesses, but we don't know, and a lot of other researchers don't know. And that's why the work that we're doing, why it's so important that we continue to do it, and we inform the medical community. The second takeaway is that we do know the cost of doing nothing, and that is that it results in much higher mortality rates. Thank you. Okay. This is going to be very tricky. I wonder why. Should we just turn that off? Okay. All right. Yeah. Yes, I think that's much better. Can you guys still hear? Okay, good. I think that's much better.